The topic of today is kidney failure, also known as renal failure. We are going to see part 1, where we have to address the definition of renal failure. But the whole topic will cover these 5 questions and the definition, the causes, and the signs and symptoms, the complications. Then we'll see the treatment and prevention of renal failure. Before we go deep into the topic, let's understand a little bit of anatomy. The kidneys are 2 organs which are located in our back, just under the ribs. They have 2 ureters, both sides, left and right, and there is a bladder where the urine will be collected, and there is urethra which helps on excretion of urine outside. In the kidney inside, there are different compartments, of which one is made of what we call nephron. Nephron is a whole unit which is helping on what? Filtration of urine. It will allow urine to come into this tube, and it will also help on maintaining the important particles that the body needs with the help of these vessels. Okay. Now, what is renal failure? The renal failure is just the failing of fulfillment of the function of the kidney. If the kidney fails to fulfill its function, that's renal failure. The failure can be acute or can be chronic. So it is acute when it is an abrupt decrease in kidney function. The chronic one, it is a gradual loss of kidney function. Gradual. Then this gradual loss of function can cause what? Can cause serious complication to the body, and this will happen slowly over a long period of time. The stages of renal failure are 5. There is just normal condition of everyone without any problem. But there is a mild one, there is a moderate, there is a severe, and there is end stage. There is what we call glomerular filtration rate. Glomerular filtration rate is the capacity of the kidney to filter toxins out. If you are able to filter and the measurements are at above 90, as they take blood, then they check, they can find the capacity. And when it fails, it is less than 15, we call it end stage renal failure. So once this unit, the functional unit of the kidney has failed, whether inside here or other parts, then it will lead to serious consequences to the whole body. There are functions of this nephron, the one we call functional unit. We are going to look one by one. What does it do and how does it help? Though it looks very complex, but it does a wonderful job. The nephron, being a functional unit of the kidneys, it helps on eliminating water and some nitrogen and other waste products. All dirty stuff need to be taken out. It's like a factory where you keep what you need, then you reject what you don't need. So it helps a lot on filtration. It's a filter. It's a filter of water and blood where the product will taken out, then eliminated, and the most important will remain in the body by what? By reabsorption. Whether glucose, blood, proteins, they will be reabsorbed. Then secretion, because these waste products need to be excreted, then they will be eliminated outside. Then this function of excretion of waste product is helped by what? This tube. This tube, after everything was collected from the nephron, which you can't see here, but they will be collected here, then it come in the ureters going to the bladder to be eliminated. Another important function of the kidney, particularly the nephron, is regulation of what? Of water, using what we call ADH, antidiuretic hormone, secreted within the brain. and it does regulate the electrolyte. We know calcium, phosphate, magnesium, zinc, all those electrolytes are very important in the body. They are maintained by the kidneys. Acid-base balance, we know that the body needs to remain a constant status. We don't need to have body which is acidic. The blood which is acidic is dangerous to the brain. You can see the blood gas. If you check this pH. Normally, we are supposed to remain between 7.35 to 7.45. So that's a wake of the kidney. Though the lungs do help us as well to maintain this pH of the body. When we talk about the pH, we are talking about the concentration of these acids within the blood. If it goes, we are normally here, we are around here. If it goes to this direction, then it becomes alkaline. But when it comes this side, as the number goes smaller, then it becomes acidic. If you are here, you can't survive. Actually here, you can't survive because acid is too much. These are the illustration of different fluids telling us what is the pH of each one of them. Okay, so what the kidneys do, the lungs do almost the same, but in different mechanisms. What happens is, once the acid is too much, the kidney will feel it. The kidney will know that the acid is too much. Then the kidney will be able to try to take this bicarbonate and try to catch this acid and eliminate it. The same way the lungs will do using another mechanisms. Okay, so continuing with function of the kidneys, as they help a lot on filtration. Kidneys are filters of the body. The way we know we use the filter when you want to take something that you want to pass through this filter, the small particles will pass, but the bigger ones will remain. The same way in the kidney, the glucose, sugar, proteins, leukocytes. Leukocytes, we are talking about white blood cells, which are like soldiers of the body. Erythrocytes, these are red blood cells. Not even one of these should pass through the filter unless it is damaged. Okay, if you see blood in the urine, it means there is a problem somewhere in the urinary system. Investigations need to be done. So part of the functions, they will be damaged or deranged if there is an increase in fluid loss, like in hemorrhage. Hemorrhage is a bleeding, or you vomiting, diarrhea, which will lead to hypotension. Eventually the vessels will collapse and the kidneys will shut down. If there is now this decrease of filtration, it will cause a problem. Or if there is a problem with this antidiuretic hormone, ADH, which is released from the brain. So ADH, once it's still functional, it causes the nephron to increase the rate of water reabsorption, which will help on the retaining of blood stream, thus increase the blood pressure. So ADH is a very important part of the function of the body. So we saw now in this part the function, the definition of renal failure. In the next topic, we are going to see now the causes of renal failure.